Hi there. Welcome to the While You Wait podcast, where it's all about helping women just like you learn about the bladder while you're waiting for your appointment with that specialist. Each week, I'll combine science, medicine, and common sense so you can learn, become empowered, and get started on your journey to dryness. I'm your host, Dr. Sarah Boyles, a board-certified urogynecologist. Let's get started. Hi there. I'm here today with Erin Devoy, who is an expert pelvic floor physical therapist. She works at Cornerstone Pelvic Therapy. And I have the privilege of working with Erinn frequently. We share a lot of patients, and it's always fun to work as a team. And Erinn, do you just want to say hi and just talk a little bit about your practice? Your practice is a little bit unique because you don't take insurances.
Yes. Good morning, Sarah. Thank you for having me on your podcast.
Oh, thanks for being here.
Yeah. Yes, I have been a pelvic floor physical therapist for 17 years. It's only been within the last 3 years that I've had my own private practice. And that really just came from a desire to provide better care for my patients and also for me to have a better work-life balance. When I was working in a company where I had to take insurance, I spent most of my time fighting for my patients to get the care that they needed to receive. I would provide documentation and insurances would deny that, and I'd have to try again. And it really felt very defeating for me as a physical therapist and for my patients. And they'd have to leave because they couldn't get more appointments or I couldn't provide certain techniques. And so I just reached a point in my career where if I wanted to keep practicing with passion and compassion, I needed to make a shift for myself and for my patients. So
Yeah.
I did decide to do cash practice.
I think that's such an important thing for, women to hear, because I think sometimes people assume that it's about the money and that's why you would go to a cash-based practice. But I think for you, and I think for a lot of providers, it's really about the care and being able to provide the evidence-based care with compassion, right? That we know helps people. And our current system just makes that difficult.
It does. And it's very sad to me that every patient can't receive the very best care because of our broken system. But I am also thankful that I work with many amazing physical therapists who still do their very best within a system that takes insurance. And so then I can confidently refer somebody out and share patients who come to me and maybe need to use insurance and they cannot afford to pay cash. I understand that, and I just want them to receive the best care possible. So I do work with PTs who are still able and willing to go that extra mile and fight for coverage and do that for their patients. I love it. I did that for many years. I'm glad there's still some willing and able to do that.
It almost feels to me like at this point in medicine, you work with insurances or many people work with insurances for a certain period of time, and then you just grow fatigued with spending your time fighting, right? And then,
Yes.
you default to a different practice model.
Yes. And then I think too, we all have different priorities and different ways that we spend our money, right?
Yeah.
And so for some, it might be coloring your hair or Botox for wrinkles. Others, it's health. And I have many, many patients willing to spend money on their health, and that's their choice.
Right.
And so I look at it in a way that those who want to come see me and need to come see me will land in my office. Those who can't, for whatever reason, I will help them find good care so that they can still reach their health goals.
Yeah. Well, and I think that's, such a beautiful thing, right? And, some people recognize that and grow frustrated with, doing things through insurance and just kind of that framework and are willing to do things on a cash base. And I think there needs to be, those opportunities for everyone, right? So you can kind of pick and choose what suits you at that particular point in time or what, you can afford and what's available to you. But I think it's important. I don't know that everybody recognizes that, oh, you can go outside of, the insurance system system and pick something else that might suit you better, and you might get better results from that.
Yes. And you have mentioned many times in your other podcast interviews that finding the right PT who's a good fit for you is also very important. And you've highlighted PTs who work inside of other people's homes, or PTs who are in practices that take insurance, or others who work like I do. I mean, you've really highlighted so many ways that you can do PT even online. There are incredible PTs who do amazing things online.
Yes.
So you get to find what works for you. And that's great.
Right. I mean, I think that's part of all of this, right? Is finding the thing that works for you, the person that works for you, and just recognizing what you have capacity for, right? I mean, I think we would, in my dream world, everyone would be seen in the office, insurance would be easier, right? And would afford for the things that we think are clinically best. But that's not really the system that we live in, right? And so then just finding the fit and recognizing that there are lots of different models out there.
Yes. And I love that.
Yeah. So one of the things that I wanted to talk to you about is exercising when you have a pelvic floor disorder. So I see a lot of women who come to the office and they have incontinence or prolapse, and they have been told by someone that you absolutely cannot do some form of exercise. And, some exercises are more strenuous, are more likely to impact your pelvic floor. But what do you say to that when someone comes in and says, no, I've been told I can't do these things?
Well, that is very unfortunate that they are told that, because exercise is so important for our physical, emotional, mental health needs. So if somebody comes to me and says that, I love being able to tell them that's not true. There are so many different ways that you can exercise, so many different types of exercise that I can keep them going with some form of exercise while we address the pelvic floor dysfunction. And so it might be modifying their current exercise technique. It might be choosing a different form of exercise, but there's no need to not exercise.
So when someone comes in and, they're really interested in exercising with their pelvic floor disorder, right? Let's say they're not ready to do anything about it yet. What are you assessing in that person?
So you're asking, they're not ready to hold off on exercise. They want to keep doing their form
So
of
someone comes in and they're like, I leak all the time when I exercise. I was told I can't exercise. I really need to exercise, right? It keeps me grounded. It keeps me emotionally stable. It makes my family happier because I'm happier. What can I do? Are there things that you assess with that person? Standard things?
Yes, absolutely. So first of all, I'm going to ask a lot of questions about what kind of exercise they're doing. So if it's a power lifter, then I'm already going to be thinking about technique, form with lifting, breathing. Are they doing the Valsalva when they're lifting? So I'm already going to ask a lot of questions about what they're doing. But then I also want to do a pelvic muscle assessment, an internal assessment and an external assessment to see if there's muscle dysfunction present, to see if there's a reason for the incontinence or the prolapse or whatever symptom it is they're complaining about. So then when I gather that information, I can help decide where the adjustment needs to happen. Is it that we need to modify their exercise? Sometimes it is as simple as changing how they're breathing and the symptom can go away. Other times it might be severe pelvic muscle tightness that really needs to be addressed. And so then we need to shift and they need to do a different form of exercise that's going to allow the pelvic muscles to change. And then once the muscles change, we can head back towards the type of exercise they like to do. And so it really does come from a physical exam and the objective findings that I see there, what they're currently doing, and we bring the two together so that we can make adjustments, but still allowing them to exercise.
I just want to go back and I want to focus on one thing that you just said. So you said that you ask them a lot of questions about technique and breathing, and that frequently, it maybe not frequently, but at times it can be improve just by improving breathing techniques. And I think this is something that is so surprising to so many women, right? Where they don't realize that breathing and technique really impacts how your whole system is working. So can you just talk about that a little bit more? I mean, how often do you see that? Is that rare? Is that pretty common?
Yes, it's so common. And I want to say that it's simple and should be common sense, but it's not. We don't have conversations conversations in our regular doctor's appointments about breathing or about pelvic floor muscles and what are they doing. And I don't know that all personal trainers fully understand this process either. And so the conversations might not even be happening in the gym with a trainer. But it's important to think about the intra-abdominal pressure that is changing when we exercise. And so yoga is going to be very different than a power lifter, and breathing matters. So the power lifter is going to need to understand what's happening when they're lifting heavy weights and how to adjust breathing so that they can protect their muscles, but also accomplish the weight, the goal that they're trying to reach. And so many people hold their breath in exercise. They brace, they're told to pull in your core, tighten your core. And that usually means to them pulling in the abdominal muscles. And oftentimes there's a locking of the throat that occurs and your breath holding. That is not helpful for the pelvic muscles. They react and also tighten. It puts additional strain on the muscles. It can cause leaking. It can lead to prolapse. It's not great for your heart to hold your breath. So there's a lot of things that go on there. And many people just don't even realize they're holding their breath. And so how do you engage your core without holding your breath? Or are there moments that you maybe need to briefly hold your breath? There's just a lot, I think, that goes into that. It's complex and should be talked about.
So I'm smiling as you're talking because I mean, I think the way you use your body is a habit, right? And we really don't have a lot of insight into it. And so I know all of this and I lift regularly and I have to do it with a mirror in front of me or I will hold my breath every single time, right? And even though I know this, I can't not do it unless I'm watching myself. And I do not like to work out in front of a mirror. But I pretty much have to, or I will hold my breath every single time. And so that's frequently something that I suggest to people. I say, when you're lifting, make sure you're watching yourself. Or, if you're working out with a trainer, make sure your trainer is watching you, right? To make sure you're not holding your breath.
Yes.
So, but all of that, is amusing to me that even when actually doing it is quite difficult. So do you think this is something that women can address on their own? Right? I mean, I know a lot of people want to really work on their pelvic floor exercises on their own, but there's so many nuances here that I think it's really challenging to kind of figure out breathing technique, pelvic floor strength, pelvic floor weakness, pelvic floor tightness on your own. What are your thoughts on that?
Well, I'm not going to say that it's not possible to do it on your own because I do run into women who are very in tune with their bodies and have a good understanding of how to use their pelvic muscles, how to breathe, come from years of working on that with someone or with reading and researching. But I would say the majority of the time when a woman walks into my office, she has no idea where her pelvic muscles are, how to use them. She has no idea if she's doing Kegels correctly. Breathing and coordinating breath with pelvic floor contraction or release is very overwhelming and complicated. And usually they've tried something that's incorrect and now we have to retrain.
Mm-hmm.
And so I would say, no, I do not think it's wise for women to try to do this on their own. I believe strongly that every woman should see a pelvic floor PT at least once, if not multiple times throughout her lifespan, so that she can be reminded of how the pelvic floor moves, how to use it with breathing, how to protect herself, and how it even functions with healthy bowel and bladder habits.
Yeah, I think there's also so much about ergonomics, right? And what we're doing in our day-to-day life and how you're using your body. Are you sitting at a computer? What are you doing, right? And how that impacts your body as a machine, right? Because we're designed to have a very specific alignment and posture to make things work the best, but very few of us actually achieve that.
Right. And I think so a big majority of the women that I see in my office have pelvic muscle tightness tightness, and they don't know that. And so if you are clenching your pelvic floor muscles or tightening your abdominals all day, because many women want to have a flat stomach,
Yeah.
then you go to the gym and you want to use your pelvic floor and core correctly. Well, it's already been contracted all day. And so it's either fatigued and isn't going to do its job well, or it's too tight and it's not going to do its job well then either. And so it's frustrating because leaking can occur just because your muscles are too tight and they can't do their job. They
Yeah.
can't react quickly and prevent the incontinence that's going to occur then.
Well, and if you have been holding your stomach in for, let's say, 20 years or more, right?
Yeah.
Because you learned that, as a teen, those are really hard things to unlearn, right? Especially when your body, I mean, I think it's always confusing for people when they've been doing something their entire life and it's been fine and your body could compensate, but then all of a sudden something happens and throws that off and your body can no longer compensate.
Right, right. And so there's so much retraining that needs to happen.
Yeah.
But that's one of my favorite parts of being a physical therapist and practicing the way that I do is that I get to come alongside women, educate them, empower them to
Yeah.
begin making changes in their bodies and encourage them along the way.
Yeah.
One of it is accountability. Come back, readdress, talk through it, problem solve, and go on your way.
Yeah. Well, I think the cheerleading component or coaching component is so very important. And I agree with you. I mean, I don't know if I've ever said this to you before, but I think, most people need a physical therapist and a counselor in their lives, right? Much more than they need an MD, right? Where they just need to check in periodically to say, oh yeah, this is working, this isn't working. How do we tweak this? I have a new job. I'm doing this. I done a new exercise routine. I had a surgery, and recognizing how an injury that is, far away from the pelvic floor can absolutely impact your pelvic floor. Right. Or not even an injury, just repetitive use, right? Holding a baby on your left hip for 6 years, right? Because you have a couple of kids in a row, right? How that impacts your alignment.
Yes, absolutely.
So changing a little bit to protecting the pelvic floor after surgery. So what are your, kind of best tips or techniques on how to use your muscles to protect a surgery?
Well, I think first and foremost, if it's possible, a woman should see pelvic floor physical therapist before she has that surgery, because that's a great time to talk about where your pelvic muscles are. Do you have good range of motion? What's your strength like? And work on those things leading up to surgery so that they're feeling very comfortable with how to use their body. And then after surgery, those things fall into place much easier. How do you use your muscles? Where are they? What does that look like? What exercises should you be doing? So that's my preference is if you're going to have surgery, great. But we want to make sure your pelvic floor can support that surgery site and function well before and after surgery.
So do you feel like you should see people only before surgery and then only have them come back after if they need anything?
No, I like to do both.
Okay.
Yes, I think so. Here's an example that's coming to mind. Say somebody has been straining to initiate urine stream, straining to empty their bladder all the way, straining for bowel movements. There are a lot of bad habits there, right?
Yep.
So say you're going to do a pelvic reconstruction and repair prolapse. So then you would want that patient to know how to relax their pelvic floor so that they can initiate urine stream well, empty their bladder, initiate a bowel movement without straining, right? And so I think retraining before surgery is so valuable. And then afterwards, we don't have to make as many major changes. You're not learning something for the first time in the midst of pain and recovery. They already know the basics, but we can work on just fine tuning that a little bit. Okay, let's review posture on the toilet for bowel movements. Let's review healthy bladder habits. Okay, let's review how you drop your pelvic floor. Even though it feels sore and you might be holding it tight right now, let's remember how to release that. And then as weeks passed and when the doctor gives approval for beginning more aggressive work, like some hands-on manual therapy, then we can work on scar tissue mobilization or gently stretch the pelvic muscles. So both before and after surgery is my recommendation.
Yeah.
That doesn't always happen. That would be
No,
perfect.
I mean it doesn't. I mean, there are some patients it's hard to get buy-in, right? Like
Yeah,
I really like physical therapy, but I also don't force everyone to get physical therapy because if you don't believe and you're not going to put in the work and time, it's not going to be
sure.
beneficial for you, right? I mean, you've
Yeah.
kind of jinxed it before you started. So I don't force people to do it. And then, there have been a couple studies that have looked at pelvic floor physical therapy and whether it improves prolapse repair outcomes, so decreases the risk of reoccurrence. And there isn't a lot of support there.
Mm-hmm.
But at the same time, it's hard for me to believe those studies, right? Because it has to help,
Hmm.
right?
Yeah, I would imagine so. I mean, if you think of somebody straining to have bowel movements
Right.
after surgery, I can't imagine that that would set
Well,
them
and
up.
then I think, maybe we just haven't done the studies quite correctly, right? We haven't been looking for long enough or, looking in the right group of patients, right? And
Yes.
I think, so much of physical therapy is education and teaching you about how your body works. I
Hmm.
think it's always helpful. I see quite a few patients after surgery who will come in and they'll have pelvic floor muscle tightness that's new that the surgery kind of brought on. And, the pain is very frightening for them, right? Because they don't know what's going on. It can be pretty intense. And, kind of understanding your pelvic floor muscles ahead of time and understanding that that can happen after surgery, I think is reassuring rather than it being a big surprise and frightening.
Yes, I agree. And I was thinking too, when you asked that question, okay, have I seen anybody in my practice who has had a reoccurrence? And there is one gal that comes to mind. I haven't tracked or collected all of the data for my patients to see who did PT, who didn't, how many visits did they have.
Yeah.
But they've only had one person who's had a recurrence. And I think there are other factors that play into that: age, hormone levels, what is their lifestyle at home after that surgery? Is
Yeah.
it grandma who's taking care of her grandkids, or a grandma who's retired and relaxed and was leading a very active, healthy lifestyle before?
Yeah.
And I, so
Well,
I
and I
just think
also think, some patients or some women just have more delicate connective tissue, right? I mean, some people have great, robust tissue. There are a lot of genetic factors there. I mean, sometimes it is related to lifestyle and nutrition, but there are a ton of factors there that can lead to recurrence, right?
I
Or
don't.
even habits like smoking, right?
Yeah. Yeah. So I don't know if those studies look at all of those, all of those details. But I think it really just makes sense when you're looking at quality of life to address healthy bladder habits, healthy bowel habits. How do your pelvic floor muscles work prior to and after surgery?
Yeah.
Quality
Well,
of
and
life.
things like, some people are just kind of chronically constipated and they've been that way their whole lives and they don't actually recognize it because it's their norm.
Yeah.
But that's a pretty uncomfortable way to live. And so, reversing that or helping someone mitigate that can make a huge difference for, quality of life if you're not having that discomfort and straining.
Yes, I agree.
So, and nobody likes to talk about constipation. I mean, we talk about all these things a little bit more now, but I don't think we talk about those things enough.
No, we should though. We should. Every woman that comes into my office, we talk about how are you pooping?
Yeah.
And it's
Yeah,
so
no, I mean
a
it's such an
moment of
important
what?
thing.
There's a new way? No, it's always been a way, but we just didn't talk about it.
Right, right. I mean, it's funny all of these things that we don't like to talk about, right? I mean, we are a little bit of a Puritan society. Do you have any other, helpful tips or any parting words that you would like to share?
I think one of the greatest joys I've had as a physical therapist is working with providers. I do not claim to know it all. I absolutely love partnering with other medical professionals who have a patient's best interest at heart.
Yeah.
And so that is my recommendation too, is work with someone who's going to be an advocate for you and help you build a team if you don't already have one, help connect you to other medical professionals who can give you other options too. I do have women come into my office and they really aren't so interested in doing pelvic muscle exercises or doing self-care and making adjustments to their how they do life. They just kind of want a quick fix. Or they want some other options. And that's where I'm okay with that. So working with you, for example, I have some complex patients that I've sent your way. I've done my very best and I feel like pelvic floor is working well, but we need more. What other options are there? Or maybe someone wants a pessary. They just want to put something in that gives them more support for their prolapse. Great. Go see Dr. Boyles.
Yeah.
So
No,
we
I
have to
agree.
read
And
each other.
I think, there's always more to learn. And I think when we work together, you just learn more. And sometimes, it's small things. When I first started practicing or at the very end of my residency, I really liked spending time with established physicians and listening to how they talk to patients, right? And what terms they use and how you communicate to people. The education part of this is so huge. And for a lot of women, that's all they want or they need, right? They just kind of want to understand what's going on with their bodies. But then there are new techniques and figuring out, just how to do things better. I mean, there's always something new to learn. And I think that's what, makes this such a fun field.
Yes, I agree. I love it. I love going to work every day and I love working with providers like you.
Well, it's funny, right? I mean, people ask me all the time why I do what I do. And I, just like you, I mean, I love it. I feel like I get to make such a huge difference in women's lives. And sometimes it's, just with education. Sometimes it's with a, better incontinence pad. Sometimes it's with a surgery. It all depends. But I think it all starts with making people feel heard and kind of understood and letting them know they're not alone.
Yes. And I think as a physical therapist, I have more time to be able to visit, listen, and establish a good relationship there with patients. And that in and of itself is oftentimes all that, a woman is looking for. Just like you said, to be heard and to feel validated in their concerns.
Well, and I think that's true, right? The way a physical therapist's time is allocated is very different than the way my time is allocated. And I like to spend a lot of time with my patients, but I don't have as much time as I would like sometimes, right? And so then I think, using a multidisciplinary approach is super helpful.
Yes, and Sarah, when I get to have a relationship with a provider like I do you, then I can take what you've shared with the patient and revisit that in my office.
Right.
And so then it helps a patient trust you more or feel heard in a different way because I'm repeating and revisiting what you've said. And so then together we're working as a team. And I love how that reinforces a plan of care.
Yeah, I agree with that. And I think patients feel that, right? When you're saying, oh, go see this person. I trust this person. They do a great job, right? And then they go there and they recognize that, but that endorsement helps you get started too.
Yes. And then when they say, I just saw Dr. Boyles and she said this and this, but I don't know, I don't remember what she said or what she meant by that, I can go over that again. And I love that piece.
Yeah, no, I agree. And, we talk about so many things in the office visit that there's no way anyone can retain all of it. And so, you frequently do have to review, right? Just because it's new information, it's different information, it's new words, all of that. So, yeah. Well, as always, thank you for all that you do. I think you do an amazing job. And I think you're just such an advocate for women's health. And I appreciate you.
Oh, I appreciate you so much. And thank you for asking me to be on this podcast with you. It was a joy.
I'll ask you again.
I will say yes, because I will take as much time with you as I can.
That's so kind of you. All right. Thanks, Erin. Have a good weekend.
Bye-bye.
Thanks for listening. If you want more information about me or my online work, check out my website at www.thewomensbladderdoctor.com.